Welcome to the New Mom Talk podcast, your go-to podcast for evidence-based answers to your burning questions about parenting. Join us as we dive into commonly Googled topics and hear from experts and real moms. Let's navigate parenthood together, one question at a time. Hi, everyone. So recently we had an episode that talked about love after baby, which was more of that connection, not so much the physical aspect of it. So in today's episode, we are going to talk more about that intimacy that consists of the physical part. So quick disclaimer, this might be a good time for you to put headphones on if you're in a car with a little one that maybe you don't want listening to this, or take a quick pause it and go to a quiet space where it's just you and the podcast and maybe some girlfriends.
Oh,
So,
thank you so much for having me. I'm so happy to be here.
yeah, thank you so much for being here. Can you start off with telling us a little bit about yourself and your business?
My name is Dr. Rose Schloff. My pronouns are she, her, hers. So I started my practice as a pelvic physical therapist, and I've pretty much specialized in pelvic and sexual health my entire physical therapy career. So I was working in a really cool biopsychosocial model approach where there was a sexual medicine physician, there was sex therapy, there was physical therapy all working together. And I got amazing information about what it looks like to treat sexual wellness from a holistic perspective, right? How do the hormones impact our libido, our enjoyment of intimacy? How do the muscles impact? How does our relationship dynamic impact? And I, like many other people, had my own health experience that was really mismanaged by Western medicine. Felt really gaslit by the medical system. And it felt like not only was I not really listened to or validated, it just felt like there wasn't like support accessible. And I saw this mirrored a lot in the patients I was working with as a physical therapist. And so that's when I started to dive deeper into some of these more holistic areas. I have a certification in health coaching and functional nutrition. I became a sexual health fellow. I studied functional neurology, which is just a fancy way of saying like how our nervous system, how our brain and all of our nerves impact our enjoyment of the moment, our ability to be present, right? If our mind is racing or we feel super anxious, we're not going to be able to connect with our partner in or out of the bedroom. And so now I use a combination of top down, meaning like we're rewriting narratives, maybe that you learned about intimacy as a child or through your religion or through your family. We're also using a lot of bottom-up approaches. So we use 30-second exercises that work with the science of your nervous system to not only put you in a calmer place so that you're able to be ready for intimacy, but also help you kind of turn up the volume on, I call it your dessert stomach for sex, right? Like, even if we're not like hungry for intimacy postpartum, sometimes we can learn, okay, what are the things that help me smell the cookies, so to speak, and actually like get my mouth watering, even if I already ate or I'm so tired I can't even think about sex. Like, what are the things that help me get in the mood? So those are some of the ways that I use the science of the nervous system, the science of the pelvic floor these days. And I work virtually. So individuals, couples, small groups of women and queer folks. And by understanding how the body functions, we can shift how we feel with a lot less effort and a lot more quickly. So that's my favorite thing.
I love that. Well, I just want to start off with that bogus rule 6 weeks. You have to wait 6 weeks, which you probably have to wait 6 weeks for anything to enter. But the reality is, who wants to be getting intimate 6 weeks after having a baby come out of you?
Right.
So, when can a mama actually start to feel good again and want this again? Because I'm pretty confident in saying that most of them are not at 6 weeks.
Yeah. So let's talk about some of the things that are at play here, and I'll give you some research. So one of the things that is at play, right, it's the sleep deprivation, it's the hormonal shift, especially if you're breastfeeding. The hormones at play will make it very difficult to be in the mood. You may experience vaginal dryness, you may experience pain with intercourse. And whether you had tearing or an episiotomy or even a C-section, that can also impact pain and enjoyment. So, just from a hormonal standpoint, there's a lot at play here. And studies show that within the first 2 to 3 months postpartum, up to 83% of people report difficulties with sex, and up to 64% report difficulties with sex at 6 months postpartum. And so, if you're 1 year or even 2 years postpartum and you're like, I don't know, it's still not quite feeling the same, know that you're not alone. And I always say it's like somebody came in and rearranged your kitchen, and now you're trying to cook. Like, where's the spatula? Where's this? Where's that? We have to kind of rediscover your body and your brain postpartum. You're a totally different person. And some of the things that may have worked for you, right? Maybe you were like a physical touch person prior to having your baby. And then after your baby, you're like, oh my God, I'm so touched out. Like, don't touch my boobs. Don't even look at me until you've cleaned the whole kitchen or, done some acts of service, right? So love languages can shift as well. But I'll stop there. I can go down many, many rabbit holes. So it's highly individual. And if you're feeling like things are different, 1 or even 2 years postpartum, you're not alone. And there's things that we can do to shift.
So, given all of that, then how can a mama just feel sexy and comfortable again? Because yeah, you're trying to discover your new role as a mom, your new body, all of these crazy hormones that are going on, but you still want to be able to have like that intimate physical connection, right? So,
Mm.
how can you get back into feeling good and comfortable and sexy?
So different things work for different people, and it's about finding your magic list. So oftentimes I will start by asking people what already feels good? What about this feels good? And what could we do to make this 5% better? And so maybe it's like, I feel 1% sexy when I dance to a song in the kitchen with you, or I feel 1% sexy when I'm in the bath alone, or I feel 1% sexy when I actually like put on makeup or whatever it is. And maybe it's not that 100% we were used to, but we start from those baby steps, and then how do we keep building and leaning into what's working? And so I think that the basics are so important of finding what feels good to us. And it doesn't always have to be sexually explicit, right? Like being in the sun and then coming back and connecting with your partner could trigger sexiness, right? Like just feeling appreciation at the type of parent your partner is could feel kind of sexy. Your partner cleaning or taking the kids off your hands so you could just have some time to self-care, like that could feel really sexy to you. And so I think the questions you want to ask are, where are these little like nuggets? Where are the 1% ways that I feel sexy myself? And what are the 1% ways that I feel like appreciation and gratitude and like drive towards my partner? That's where I would start.
So, given all of the transition that your body would be going through, and you did mention, so I'm kind of jumping back again, that it can even be 2 years postpartum before it starts to feel good. So, what can mamas do to either get that support or whether it's at home to help whatever's going on down there get the love that it needs so that it can start to feel good again?
Yeah, absolutely. So I want to highlight here the difference in desire types. I think that would help us like give a framework for some of this, and then we can talk about some hands-on techniques for like locally at the genitals of like, okay, do I need to work on my scar? Do I need to increase desire here? So one thing I want to highlight is educating yourself and your partner on what's typical or what's common, even not in the postpartum period. People, women and people with vulvas, only 15% of the time experience what's called spontaneous desire. This is like, I look at my partner and I'm in the mood. That's that kind of like hunger that I was talking about. only 15%. And so if we were used to that at the beginning of our relationship, or maybe our partner experiences more of that, just normalizing like, yeah, that's not the way most women, especially women in long-term relationships, especially women who are postpartum, are experiencing desire. So if we're hoping to get back to that place, most of us won't. Now, 30% experience what's called responsive desire. Now, responsive desire is where we have to respond to something, usually something a little sexy, meaning like erotic fiction, or you're watching a sexy movie together, or maybe it's a massage, or you're kissing, something that basically you go body first, right? You smell the cookies. And so 30% of women and people with vulvas experience that type of desire. And so when we start to think of, okay, what are the things that help me kind of get in the mood? Is it listening to a sexy audio book in the 5 minutes of downtime I have, or maybe I put one earbud in while I'm driving the kids and I am there somewhat, or maybe I'm putting one earbud in when I'm doing stuff around the house. So that's a way that we can start to kind of like smell the cookies throughout the day, keep sex at the forefront. Now, the other way that people experience desire, this is 50% of women and people with vulvas, this is contextual desire. So this means like if you've ever gone on vacation and been totally in the mood and had amazing sex and then come back home and been like, why not now? The context matters. And so I always say that the key for responsive and contextual desire is not just, something sexy. We also have to be in the nervous system state to be ready to feel it. So think about desire, like not like a light switch where you're either in the mood or not in the mood. It's more like a car. And so even though I'm wearing the lingerie, even though I'm trying the wine, we use the lube, right? Like maybe even I try the erotic stories and like nothing's really working. I'm pushing the gas, but if your nervous system is stuck in the brake position, or even the reverse, if you've experienced trauma, either birth trauma or sexual trauma, if you've experienced pain during intimacy, if you are in the point where there's a lot of pressure internally or externally in your relationship, and even if your partner goes to grab your hand, it feels like, oh my gosh, I don't want them to get the wrong idea. I better shut this down right now. Right. So we can be in reverse. And so recognizing what are my gas pedal items? What are the things that help me get in the mood? And what are the things that are the brakes? And so once we get clear on that, we can start to create some support systems around the brakes. Now, that's one piece of the puzzle. Another piece is just reconnecting to this part of our body, either through pelvic floor physical therapy. They also see that mindfulness significantly improves desire, genital arousal, ability to orgasm, and significantly decreases sex-related distress. And so, creating a mindfulness practice where you're just bringing your attention to the genitals in a loving, compassionate way. So often, if we do have scar tissue or if we have had trauma, we're hesitant, we're fearful in this area. Even if we haven't, we might feel like our genitals have changed since our baby, and we're like, I don't even know what's going on down there. I don't want to look at it. I'm afraid. Or if you have looked, you're like, wow, this is really different. I feel disconnected. And so sometimes even just, I always keep my pelvis nearby. If you're listening to this, I'm sure we can share the video later, but you can just gently kind of place your hand outside. It could even be outside your clothes, outside your underwear, just over your genitals, and having that gentle mindfulness and just breathing, if you do mindfulness, if you do meditation already, even 1 minute, 2 minutes, reconnecting to this part of your body. And we know that when we're breathing through our diaphragm, our pelvic floor and our diaphragm have a piston-like relationship. When we breathe in, our diaphragm lowers and our pelvic floor relaxes and stretches. As we breathe out, the diaphragm lifts, the pelvic floor lifts. And so if we bring our awareness a little lower to the genitals while we're breathing, we can also bring some mindful, compassionate awareness to this area. And so it's just about reconnecting. And we may need to mourn the changes. We may need to say it's different than it was before, and I have some anger or I have some sadness or maybe even some fear about that. And how can I take care of my body as it is now? How can I love on my body as it is now? How can I reconnect to this part of my body and start to reclaim it as a part of who I am?
Pregnant and feeling uncertain about postpartum, or had your baby 4 to 6 months ago and struggling to get through the days and nights? You're not alone. The lack of support for moms in the postpartum phase of life is a massive issue, and it's not your fault. You deserve to feel energized, be present, and feel calm and confident after your baby. I'm Natalie Welch, perinatal registered dietitian, aka the mom's nutritionist. In my postpartum prep for moms and renewed mama programs, we work one-on-one to get you showing up how you always envisioned through simple lifestyle and nutrition tweaks. Head to my website at nataliewelchrd.com to learn more and grab my free postpartum care plan now, and tune into the Birth of a Mama podcast for stories and expert guidance from and for real moms like you.
So many like different ways to, yeah, go about it and to find that connection, but definitely find what works for you, right?
I'm all about choosing your own adventure. I always tell people, I'm going to give you a buffet and you're going to choose what works for you because we are all such individual beings, but especially sexually, right?
Yeah. Well, and even more so after you have a baby, like you said, your sex drive tends to lower because of all the crazy changes and things that are going
Yeah.
on. So essentially, it's a matter of being able to use a lot of those tools or find the right tools that would work for you to help increase that desire, right?
Yeah. And I
So,
want to just normalize too, like we might need or want to use toys more than we did prior to having a baby. Our sensation might be diminished. This can also happen as a result of hormonal changes. And so you might find like, wow, it was so easy for me to reach an orgasm prior. And now I've got one ear open, trying to hear if my baby's waking up. I'm not fully present. The sensations are different. It's really hard for me to reach orgasm using toys like vibrators or other, just, just like I tell people, you can either brush your teeth with a manual toothbrush or you can use an electric toothbrush, and it's a lot faster and easier to get a thorough clean if you use an electric toothbrush. And so during this season, especially when we don't know, I don't know how much time there's going to be to get into it, right? My kid might wake up, or, my older one might be knocking on the door, right? Like asking for us. And so there's a big shift, and we might need to use toys so that we can have more satisfying and positive encounters when we are having encounters. And then we might need to shift our idea of foreplay. So maybe it's not 45 minutes of foreplay uninterrupted. Maybe it's sending texts to each other throughout the day of appreciation and gratitude. Maybe it's we each individually listen to whatever helps us smell the cookies. Maybe it's, hey, you take the kids so I can take like an everything shower and then I'll feel sexier, right? That's my 5% or whatever. And so we're starting to stack these strategies. And even if these strategies help you 1%, 5%, when we start stacking them, it's kind of like compounding interest, right?
yeah, I love that. I just even thinking about it, like the other day, I was telling my husband, God, I really just want to go get a pedicure because I don't like wearing open-toed shoes if my nail polish is not looking clean. And it's so true, like that, just that little task of like
Yeah.
getting your toes done, like just makes you feel more put together and
Yes.
more confident.
Yes. And you're like, look how sexy my feet feel. I feel
Exactly.
5% sexier. And here's the thing, in the postpartum period, exhaustion and decision fatigue is so real. So start keeping a list on your phone. Start keeping a list of here's my 5% sexier list. Put pedicures on your list, right? And whatever else, maybe it's my partner cleans the kitchen. That's on my list. Maybe it's like I took a walk outside and I saw the sun. That's on the list. But keep the list so that when we're in that moment of like, oh, I finally do have a moment for myself, I could do 1 million things from laundry to dishes to picking up the toys to, oh, self-care. What would I even do for self-care? I'm so tired and I'm so hungry and I could, right? Having that list to go back to takes the decision fatigue out of that present moment. So we're basically like creating a menu ongoing.
I love that. Well, my last question, do you have any other tips, suggestions, or recommendations for anyone that's needing a little bit of love and support in this area?
Yeah, absolutely. So I always say compassion first, always. So if you take nothing away, nothing else away from this talk, take away that you're not broken. Take away that there's nothing wrong with you. Take away if your libido and your enjoyment of and your ability to be present during sex has changed postpartum. You're not alone. And there's things that we can do to shift. And so often our internal monologue, it makes it even harder for us, right? Like, what's wrong with me? My partner's going to be disappointed in me, all of these thoughts. And so starting with compassion first always makes perfect sense. I'm feeling this way. I'm exhausted. It's so common. So start there. Then I like to create boundaries. So helpful boundaries where we're getting clear on like, if your partner is initiating sex every day at 1 a.m. and you're like, that just doesn't work for me, right? Like getting clear on what are your green zones? Like when are you most likely to be in the mood? When are you most open to smelling the cookies? And I love, instead of asking, are you in the mood? I love to ask, are you open to seeing if we could get in the mood? Right? Taking the pressure off the outcome, making it more open. But when are you most open to seeing if you could get in the mood? Is that like a Saturday morning if your parents take the kids, right? Is that could you have a friend take your kids every other week during a certain window when you're not as exhausted and that's your time to connect, right? So have those helpful boundaries so that you know this is when sex could work for me. And I also want to say, taking the pressure off of penetration and orgasm is very, very helpful. Using this time to focus on pleasure, to focus on connection. And so then if we have 5 minutes, it's like, okay, I'd love to connect with you. Can we just kiss for 5 minutes? Can we hold each other for 5 minutes? Can I look into your eyes and, you know, just straddle you for 5 minutes? Whatever makes you feel close to your partner. When we're decentering penetration and orgasm, it opens things up for us to get really creative about ways to connect and ways to feel good. And so creating that roadmap also allows us to relax a bit more when we don't have those agreed upon windows, right? Maybe it's like 11 p.m. on a Thursday and your partner goes to hold your hand. You can just enjoy the handhold because they know that after 11 p.m. you're not going to be open to initiation, or if that's true for you. I'm not saying that this is like a global rule, but during postpartum time where you are tired, I know. And so, right, talking about when is it most likely, and then we can enjoy the intimacy that we are having. And then the last step that I lead people through is baby steps. We've hinted at this a lot through the podcast, but I love that 1%, 5%. And I like the idea of starting with the smallest possible piece that you can grip onto and then slowly, slowly, slowly expanding it. And so once you find your 1%, once you find your 5%, ways that you connect, ways that you feel good with each other, ways that you feel sexy with yourself, ways that you appreciate and find your partner sexy. Once you find those little nuggets, then you get to ask each other, what would make this feel 5% better? What would make this 5% easier? What would turn up the volume on this 5%? And you go with what's working for you and you keep turning up the volume. You can alternatively use baby steps to turn down the volume on the things that aren't working, right? Like, oh, it really doesn't work for me when I wake up in the morning and there's like nothing's been cleaned in the kitchen. Like, could we do a 5 minute shift in this? Is there any way to make this 5% better? And so I think in the postpartum time, the needs are exceeding the capacity so often. And so it's like we care about our partner being healthy and happy and having their needs met, but we feel so at capacity that it feels impossible. And so by starting with baby steps, we can use this even outside of the bedroom to collaborate and shift little by little. So those would be the 3 steps that I would start with.
There's a lot of shifting when there's a little human
A
in the
lot.
picture.
Yeah, absolutely. And
I
and
always,
let's normalize like it's not going to look the same every day because like life with a little human looks very different day to day. And so having grace with yourselves and then knowing, okay, these are our kind of like our flagpoles where we're trying to return back to, but like it's going to be a little wobbly during this time, and that's okay. We love each other and we're here as a team.
yeah, such good points. Because it's easier as they get older, where maybe you have a little bit more of a, I'm going to put this in quotes, schedule. But newborns, yeah, that's non-existent.
Yeah. And so it's all about sexy snacks, whether that's like for yourself or for, your time together. What's the sexy snack? And sometimes I'll even tell people like, okay, if you need Netflix time to just zone out, like, could you make that 5% sexier? Maybe you're, giving each other touches while you're watching or like giving each other shoulder rubs for 1 minute, right? Like it could be as small as you want it to be.
Yeah. Yeah, I love that. Well, thank you so much. I appreciate you coming on and sharing all of your tips and just normalizing that it's not, it shouldn't be expected for you to suddenly have that drive and that it's really not high to begin with before having a baby. So,
Right. Right. And there's tools that we can use once we understand that physiology to turn up the volume little by little.
yes. Thank you so much.
Yes, thank you. And if you're listening to this and any of this resonated, I love hearing from people. So please shoot me a DM on Instagram at Be Well with Rose and let me know like what are you taking away or if you have any additional questions for me. Love to interact with people.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.